in our communities and this humanitarian crisis at our border. Thank you, Mr. Chairman.
Thank the gentleman. And now the chair recognizes the chair of the full Energy and Commerce Committee, Ms. McMorris Rodgers, for her 5-minute opening statement.
Thank you, Mr. Chairman, and a big thank you to everyone for being here as we roll up our sleeves to go to work to address the border crisis, the fentanyl crisis that's been driven by President Biden's open borders agenda. It's putting Americans all across this country at risk, turning every town into a border town. More people than ever are dying from fentanyl poisoning. Most heart-wrenching is that fentanyl is an attack on the young generation. The #1 leading cause for death for Americans between ages 18 and 45 is fentanyl poisonings. Last month, in my hometown of Spokane, Washington, law enforcement from Drug Enforcement Agency, DEA, the Federal Bureau of Investigation, FBI, and the Spokane Police Department seized 35 pounds of meth and 50,000 fake pills believed to be laced with fentanyl. It takes just one pill to kill. That was Molly Kane's message to us when she testified before our committee a few weeks ago. She's pleading for action and for justice for her son, Carson. He should be alive today, but one pill he purchased off of Snapchat killed him instantly. No parent should have to feel Molly's pain. Most illicit fentanyl and fentanyl analogs being smuggled across the border are being produced by cartels in Mexico with precursor ingredients sourced by China. Criminals and drug dealers are selling these deadly substances in communities that are killing a record number of Americans, 71,000 in 2021. Nearly 2/3 of drug overdose deaths in the United States in 2021 involved synthetic opioids. So far in 2023, DEA has seized 4.5 million fake pills laced with fentanyl, and Customs and Border Patrol seized more than 1,400 pounds of fentanyl. And this is just the amount that's been seized. How much is being missed? The U.S.-Mexico border is close to 2,000 miles long. How many pounds of fentanyl are coming across the areas that are scarcely monitored between the ports of entry? That is why we need to secure the border, secure the southern border, and stem the flow of these weapons-grade poisons. The Biden administration is set to do the opposite and create more chaos if the president ends Title 42 protections. That cannot happen. Republicans are offering alternatives to keep people safe and save lives. For example, Representative Lesko has legislation to update Title 42 so that it can be used in cases of situations we see with the fentanyl crisis. We also must pass the Halt Fentanyl Act, led by Representatives Griffith and Latta, to permanently place fentanyl-related substances into Schedule 1 of the Controlled Substances Act. This will ensure that our law enforcement officials have the tools that they need to keep these poisons off our streets. As DEA has told us, this permanent scheduling is their top priority. In addition to discussing the fentanyl crisis, we will examine today how the influx of migrants is straining hospital capacity and making it harder to treat patients. Yuma Regional Medical Center in Arizona has already had to delay care for patients because of the surge they see. They've had to hire additional staff to keep up with demand. El Paso, Texas, declared a state of emergency. The mayor said hundreds and hundreds of people are living in unsafe conditions because of the migrant surge. These challenges created by President Biden's open border agenda have only been made worse by the COVID-19 pandemic and workforce shortages from vaccine mandates. The status quo is unworkable, and it's harming patient care. I look forward to hearing from each of our witnesses. Thank you for being here on the ground, on the front lines of this border crisis. We want to know what more we can be doing to ensure that our future is secure and that our communities are safe. Thank you, and I yield back.
Thank you very much. The chair now recognizes Ms. Craig for 5 minutes for her opening statement.